Reagan Robertson here with Productive Dentist Academy. Get ready to join your favorite podcast hosts, Dr. Bruce B. Baird, Victoria Peterson, Dr. Chad Johnson, and myself, Reagan Robertson, at the nation's #1 dental business course that guarantees practice growth. That's right, full immersion CE, so you can consistently produce more and align your team for results without compromising excellent patient care. Productive Dentist Academy has a special running this month that you can activate immediately. It's called the PDA Productivity Bundle. And we put this together so that you could attend this workshop, which is happening September 22nd to the 24th in Frisco, Texas at the Hyatt Regency, along with tools to make sure that not only are you getting great education on how to increase your productivity, how to communicate better with your team and your patients, increase your case acceptance, authentic market practice, and more, you also get a 2-hour business advisory session before the workshop to really get clear on what matters to you most so that you can be set up for success at the workshop. And following the workshop, you get 12 months access to PDA on demand. That is the entire productivity workshop on demand for you to make sure that you are doing everything you can in your power to soak up all of that CE and implement it come Monday morning, the next month, and the next month, and the next month for 12 months down the line. Registration is now open. The tuition cost is $2,195, which is ridiculous because it's regularly $5,528 for the productivity workshop attendance, 2-hour business advisory session, and 12 months access to PDA on demand. Hop on over right now to www.productivedentist.com/workshop to grab your registration today. Again, that is www.productivedentist.com/workshop. If you cannot wait and you have to have it right now, email Brent, B-R-E-N-T, at productivedentist.com. That's Brent, B-R-E-N-T, at productivedentist.com, and we will save you a seat. I look forward to seeing you there.
Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
Hi, this is Dr. Bruce Baird with the Productive Dentist Podcast, and we're excited. This week, my new book comes out called Legendary Leadership, and it should be available on Amazon and in the bookstore. So really look forward to you guys read it and give me some feedback. It's really a story of just, my journey as a leader, which has been quite a journey. And I joke with people all the time about, there are certain people that are reading that book and see that I wrote it and it says Legendary Leadership. They're probably choking on their breakfast right now because I was not that good leader starting out. But anyway, that's going to be available this week. Our Productive Dentist Workshop is coming here in about 5 weeks in September. So I think we have a few spots left. I'm not 100% sure of that, but that is coming up in September. You can always go to our website and take a look at it and see that. Today I'm going to talk about SOPs, standard operating procedures, which sounds like really boring stuff. But what I'll tell you is early on in my career, as I was trying to explain to my team what it is you need to do and to hold people accountable, they need to know exactly what it is that you're doing. So when I look at a standard operating procedure, you can buy them from people, they make them for you. That's a waste of money and a waste of your time trying to show your team what to do. But what we did, and there's every different area in the office. I mean, from the front desk, how do they answer the phone? What is it that you want them to say? Go through scenarios with them writing it all out, because you want this to be the standard operating procedure. I remember when people would answer the phone, when we first opened our office, they say, "Hi, my name's Mary. Welcome to Granbury Dental Clinic." Well, I didn't like the word clinic. I wanted it to be Granbury Dental Center. Now that seems like a little thing, but it's something that kind of irritated me every time I heard them answering the phone that way. And so we wrote up a script for the front desk of exactly how they answer the phone, exactly how you greet people at the front desk. Now, they're going to use their own twist on it, don't get me wrong, but I want them to have a playbook. You would never, SOP is a playbook to play by. And a football team wouldn't go out on the football field without having a playbook to know what plays they're running. I've often talked about Disney. When you go to Disney, the characters all say the same things, and they have that standard operating procedures. And so I wanted that to be that way in my office. And so early on in my career, I began to do that. Let's say first with the front office. Second, what's our standard operating procedure for checking hygiene patients? What do I need? How do I go about doing that? And so we would write out the entire process. My hygienist, when the patient was seated, they would bring me a piece of paper that would have listed on it the patient's risk factors that we had previously gone over in their complete exam. It has, if they had a occlusal guard, are they wearing it? We went through all of these areas and come check. And so I would have the entire hour that patient is in the chair to come in and check. Now, a lot of people say, well, why, if you go in the first part of the appointment, why are you going in that early? Because they haven't cleaned their teeth yet. I'm not checking the teeth cleaning. I'm not going in to make sure they got all the calculus. That's not why I'm going into hygiene. Why I'm going into hygiene is to look at their treatment plan that's been previously done, look at any emergency things that have happened, or anything that maybe not an emergency, but something that's come to the top of the list. And so we spelled all those things out in our standard operating procedure. And that really, really helps when you're going in. My average time talking to my patient in a hygiene check was probably 2 minutes max. And the reason is my hygienist was trained to go back to the treatment plan that has been previously done. If they hadn't had a treatment plan, if somehow they ended up in my hygiene without having a comprehensive exam with me, then we would set up a comprehensive exam at that appointment, and go ahead and set up a time so that I could go through the risk factors and all the things that I've shared with you guys in the past. This is, we're going to go through perio risk. We're going to go through biomechanical risk. We're going to go through aesthetic risk. We're going to go through all of the things that we need to go through, because my goal was every single patient had a complete treatment plan. That doesn't mean they'd had all their work done. And that's why I go into hygiene, to find out the work I recommended last year. How is it getting worse? Are we having a problem? Or go on to look at other things that may have happened during that time frame. So that was it. And we wrote it out, everything in detail, what I was looking for. My hygienist would say, "Dr. Baird, we're ready to get going on these veneers. We talked about it." And, in other words, they're looking at that treatment plan, my hygienist, and they're using that as their guide on what to do. Now, cleaning the teeth, yeah, they're going to clean their teeth. They're going to do whatever it was at their appointment, but that's not why I'm coming in to check the patient. Then let's get back into what about the standard operating procedure? And there's SOPs for everything you do in the office, how you file insurance, how you do this. But I'm going to talk more about the back, the clinical part of this. Why would you need a standard operating procedure for clinical procedures? Well, if you're like most dentists, they may never have changed their protocol their entire career. They do things the same way. Well, that wasn't me. That I was constantly looking for better materials, things that would save time, things that were rated higher than other materials. I would try them. If I liked them, that would become part of my SOP. But we would write down, for instance, tray setups. I want this exact tray setup. And not only would we set up a tray, this is for endo, this is for oral surgery, this is whatever. These are the things I want, but we would take photos of it. So we had pictures, we had written details. And when we're training somebody, a new employee, a new assistant, it is the way I like to do things with me there, seeing a new patient with this endo. This is the protocol that I use. Now, if you have 2 or 3 docs, clinical protocol, ours were close, but they weren't exactly the same. So they need to write up their protocol of exactly what they want, take pictures of exactly the way they want their tray setups. It sounds like, a little anal retentive, but we're a dentist, so that fits the mold. But what I'm saying is, we've talked in the past of how important training is, how important getting, you can't be upset when people are doing it exactly the way that you recommended it. And if I'm sitting there doing endo and they go, oh, I forgot the sealer, oh, I forgot this, I forgot that. No, we set it up the same way every single time. Now, how do you become productive? How do you become massively productive? By doing that. Does it take time? Yeah. I mean, it might take you a day with your team in the back. This is how we want to do it. Bam, 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 bam. But it's worth it. That's why I was able to work Mondays and Tuesdays for the last 14 years of my career and still produce over $2 million a year. It was because my team knew exactly what we were doing and exactly the procedures, exactly the materials, exactly the instruments. Everything was spelled out. And again, it sounds like a lot of work, but you only have to do this work one time. And once you've done it and you trained your team, now it's your responsibility. Remember, we talk about, accountability, looking at things and making sure it's being done that way. Well, you have to rarely do it, but then just check the pictures, everything else. Are we still following our protocol? You'll know it because you'll notice that something's missing on the tray or something's not there. And that takes more time. They have to get up and go. And when you're producing, I'm not worried about seconds and minutes, but I'm worried about how long does it take me for the overall procedure. And I would very much like for everything that I use to be in that room. So I can do that. Standard operating procedures. It's your game plan. It is your playbook of what you're going to do every day. Anybody can help set up a room. If you have somebody that's sick, that is set up. They can look at the pictures. They can set up a tray for you. Sometimes, if the office got behind, which was very rare, but if it got behind, we'd ask a hygienist to set up a tray for us. Well, all they do is go to the playbook and open it up. And by golly, there was exactly what we expect for the setups. So it's hard to, and for me, when I hired people early on, I just expected them to know these things. Well, you're an assistant, you should know how to set up a tray. Well, that's not fair to the assistant. It's certainly not fair. And because they don't know how you like it. They may have worked for 4 different dentists, and 4 different dentists are going to do things 4 different ways. There was a study they did when I was back in the military. They sent out to prosthodontists, in the U.S. Army. They sent it out a simple RPD, removable partial denture design. And they said they wanted each one of the prosthodontists to do their own design of what they thought was the best design. And they had 60 prosthodontists, and all 60 of them did it differently. Well, that's the way we are, but I want my team to know exactly how I want it. Because like it or not, as you go through the day, little things that aren't the way you like it kind of cause stress. And we've talked about when you're stressed, what happens to productivity? It goes down. So this is a very, very big deal, in my opinion, is having a standard operating procedure for every single thing. How do you want insurance filed? How do you want, how do we want recare taken care of? How do we want, and you can write this all down, all the different arenas or all the different areas in your office. You want standard operating procedure, and just plan over the next year. Over the next year, I'm going to go through each one of these. I'm going to get advice from people who are specialists in it, front desk, when we go to seminars, when we go hear people speak, there are people out there that, they're the best at the best, of how they do it. It may not be the way we do it, but by going through this process and setting up exactly what we want to do, guess what? Our team is happier. They know what you expect of them. And it's something that may take a little time, but it's going to be time well spent. So, that's my story on SOPs, but it's something that I really challenge you to do, because guess what's going to happen at the end? There's going to be less stress, and there's going to be more productivity. You're going to be able, and the ultimate is you're going to take better care of people, because you're not waiting around rolling your eyes for a mirror on your exam tray, like I've said before. So anyway, that's this week's podcast. We're getting out of summer and we're ready to start the fall. This is the first day of August, and I hope you guys have a great week, and I look forward to talking to you again next week. And remember, sign up for Productive Dentist Podcast. Tell your friends, and if you have any questions, please send it to bruce@productivedentist.com. So look forward to seeing you.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.